Hello, and welcome to our webinar series showcasing the outstanding work of community agencies across New York State funded by the New York tax checkoff dollars to reduce mental health stigma. I'm David Minot, Executive Director of Mental Health News Education, publisher of Behavioral Health News and Autism Spectrum News. I'm honored to have the opportunity to highlight these impactful projects and share with you the details of this important stigma reduction work. This series of webinars aims to highlight the innovative efforts of 7 organizations funded by the New York State Office of Mental Health for Stigma Reduction Community Initiatives in 2022 and 2023. We'll learn how these agencies identified targeted audiences within their regions, tailored their engagement strategies, and chose their interventions to address specific types of stigma impacting their communities. Stigma remains a significant barrier, discouraging individuals from seeking mental health support and limiting opportunities for those experiencing these challenges. However, local community providers possess invaluable knowledge about the populations they serve, positioning them uniquely to develop the most effective anti-stigma interventions through tailored outreach, marketing, education, and contact-based efforts. Over the course of these 7 webinars, we'll dive deep into the real-world experiences of these agencies to explore their methodologies, the challenges they faced, and how they measured the impacts of their interventions. Their stories offer a wealth of insights for other organizations looking to implement successful stigma reduction initiatives in their communities. We will also examine the key elements essential to any stigma reduction project, including understanding the target audiences, defining engagement strategies, setting clear goals and deliverables, and developing mechanisms to evaluate both qualitative and quantitative outcomes. Ultimately, these webinars aim to stimulate broader interest and collaboration in the fight against mental health stigma and increase mental wellness across New York State and beyond. We will include contact information at the end and encourage you to reach out to today's speakers to discuss how you can replicate a similar project in your own community. By fostering community coalitions, we can amplify our collective efforts and drive meaningful change. Once again, thank you for joining us and enjoy today's presentation.
Welcome. We are the National Alliance on Mental Illness of New York City, NAMI-NYC. And we help families and individuals who are affected by mental illness build better lives. My name is Matt Kudish, and I am the Chief Executive Officer at NAMI-NYC, and I'm excited for my colleagues to introduce themselves.
Hi, my name is Jennifer Rares. I'm the Director of Marketing and Communications at NAMI-NYC.
Hi, I'm Lorena Valencia. I'm the video producer at NAMI-NYC.
NAMI-NYC is dedicated to both the well-being of both individuals and family members who are grappling with the challenges of mental illness. We proudly serve diverse communities within the 5 boroughs, and our virtual programs have reached more than 36 countries throughout the world. From evidence-based education classes to over 40 support groups that meet every single month, people find a nurturing space to learn, heal, and connect at NAMI-NYC. Family members discover valuable, one-of-a-kind support through our free programs and services, which allow them to connect with other family members who understand what they're going through. We aim to be a beacon of hope for family members navigating the complexities of caring for a loved one living with mental illness. We also offer signature programs exclusively in Spanish. At NAMI-NYC, we think it's more than offering translation and interpretation. We develop customized, culturally responsive programs that are led and run by volunteers, and in this case, community members who identify as Hispanic or Latino. In a landscape where mental health support can feel scarce, NAMI-NYC is a lifeline. Anyone can call our non-emergency mental health helpline in English, Spanish, and 180 other languages. And to learn more, you can visit www.naminyc.org/helpline. Now we'll play our PSA video, and then I'll tell you a little bit more about the Mental Health Stigma Reduction Project.
Desde que nos mudamos a Nueva York, el comportamiento de mi hija cambió repentinamente. Sentí que se estaba alejando de mí y no sabía cómo ayudarla. Un día me di cuenta de que necesitábamos ayuda y decidí romper el silencio. Me di cuenta de que para ayudarla a ella tenía que comenzar por mí. Hablar con alguien acerca de cómo me siento no solo me ha ayudado a entenderla, sino que también salvó nuestra relación. Conversar abiertamente sobre la salud mental nos acerca y beneficia a todos. No estás sola. Más de 1/3 de los padres o tutores latinos han padecido de depresión, ansiedad y otras condiciones de salud mental. Acérquese a NAMI de la ciudad de Nueva York. Estamos aquí para apoyarles sin ningún costo.
In this PSA video, we shine a light on the often overlooked struggles of Hispanic and Latino caregivers who experience elevated levels of depression and anxiety. The narrative unfolds depicting the strained relationship between a mother and a daughter due to her daughter's mental health challenges. As the story unfolds, the mother realizes she too needs support to navigate her role as a caregiver, parent, and family member. The video underscores the crucial need for caregivers to prioritize their own well-being. Family members can't change their loved ones. Their loved ones are doing the best they can. But instead, when family members learn and change and grow, they impact the entire family dynamic. At NAMI New York City, with greater knowledge and support, caregivers are empowered to better understand and manage their roles, fostering healthier relationships with their loved ones. And now we'll talk a little bit about the target audience for this project. Lorena.
Thank you, Matt. The Hispanic Latino community faces significant stigma surrounding mental illness, as well as face challenges accessing care. Language barriers and the lack of bilingual practitioners are just a few of the reasons many Hispanic Latinos are left without the support they need. In addition, the COVID-19 pandemic has disproportionately impacted this community. Despite these challenges, NAMI-NYC has made efforts to address stigma and improve access to care. We work and advocate for comprehensive, affordable mental health care for all New Yorkers. And so for this project, we conducted early stage research, such as focus groups, interviews, and community outreach efforts to better understand the needs of this community. As a video producer, I led extensive field studies across New York City. We interviewed people who identified as Hispanic or Latino, but also Black, Asian, multiracial, white people. We conducted interviews in English and in Spanish on the streets of New York City, and all these interviews were anonymous. In the past, we found that when people required to give their names, even if it's just the first name, they were not as candid about mental health topics. These interviews were audio recorded, and then we organized them by data, theme, race, age, and zip code. Our field research provided valuable insights into the attitudes surrounding mental health within these communities. Now we'll chat about the types of mental health stigma we're addressing in this PSA.
Thanks, Lorena. So we wanted to learn about how real New Yorkers talk about mental health and mental illness, and we saw various types of stigma in this community. There's an issue of self-stigma, so shame around mental illness and talking about it. In the Hispanic Latino community, participants kept this information within their families or within their faith communities, or didn't discuss it at all. Participants also expressed concern with public stigma, the fear of being dismissed or judged or called crazy. And of course, we saw institutional stigma as well, where participants face challenges in finding culturally responsive mental health care in their language. In this PSA, we primarily focused on self-stigma, the ability to discuss emotional problems with close family members and friends is the first step to breaking down the stigma and accessing necessary care. And we didn't realize the tremendous impact our PSA would have. I'm going to talk a little bit about the deliverables for this project, and let me share a slide. So for the project, the main deliverable was creating the actual PSA video. And then we wanted to share the PSA to spread awareness and create dialogue around mental health. So we put together a toolkit, and in this toolkit, we had email templates, social media posts, opportunities to share personal stories, how to host a community discussion, and downloadable posters like the one here to put in libraries, coffee shops, grocery stores, any kind of local business. We gave our community members everything that they needed to share the PSA video. Our distribution strategy included all of our organic channels, including a website landing page, our monthly newsletter, social media posts, standalone emails in English and in Spanish. We also reached out to local media in the 5 boroughs, and that included CUNY TV, BRIC, Queens Public Television, Manhattan Neighborhood Network, BronxNet, and FYI. We also reached out to more than 25 community organizations serving Hispanic Latino New Yorkers, and this resulted in a deeper partnership with the Brooklyn Public Library. Together, we hosted a community conversation and an in-person focus group. We also hosted with them a mental health resource fair, including other nonprofits like Make the Road New York. And as I mentioned before, we were surprised at the immediate impact of the PSA within 1 hour of viewing. So initially, we thought that we would reduce stigma by maybe 15 to 20%. And it turned out, using our pre-post surveys, that we were able to reduce stigma by 50%, sometimes more in certain areas. So before and after watching the PSA, we facilitated a brief focus group, and then we asked participants to take a survey. And we used this Likert scale from strongly disagree to strongly agree. Participants seemed to significantly shift their attitudes after watching the PSA. So for example, more people said that they wouldn't hesitate to seek care during a mental health crisis. More people afterwards agreed that therapy includes being part of a supportive community, like at NAMI-NYC. Some were more open to discussing their loved ones' mental health problems with family members or friends. After watching the PSA, most people said that people with mental illness experience stigma, including labeling and stereotyping, so acknowledging that reality. And most said anyone can develop a mental illness. We saw a significant change in the last 2 statements, which should suggest that participants now understand that mental illness can affect anyone. And Lorena is going to discuss more about how we measure the impact of the PSA.
Thank you, Jen. Yes, we hosted 3 focus group sessions, 2 conducted virtually and 1 held as in-person community event at the Brooklyn Public Library. So for these focus groups, we ask questions before viewing the video. Participants talk about their definition of mental health. And the questions that we asked were, how can you best describe mental health? And do you know anyone dealing with a mental health challenge? After that, after viewing the video, we asked participants questions like, how can you relate to this video? Most of participants said like, yes, I know a family member, or like I've been in this situation. So that shows a little bit of how they related to the video. Also, we asked what is most memorable about this video. The majority of these people said that the family connection. They feel very attached to family, and that's what they remember the most about the video. Another question we asked was, can mental illness affect anyone? Why yes or why not? And most of the people say yes, definitely mental illness affect anyone. And one of the last questions was, if you or a loved one were struggling with a mental health challenge, what would prevent you from asking help? Some people talk about stigma, but mostly difficulties access to the mental health system, cost of the treatment, and of course, language barriers.
And what Lorena described is mostly the questions for the focus group before and after viewing the PSA. And as I was mentioning before, with the metrics that we use, folks also filled out a brief pre and post survey, and they were able to weigh in on willingness to seek help, how to access therapy and community, talking about mental health with family and friends, attitudes about people with mental illness, and how common mental illness is. The focus group conversations and the surveys were in English and in Spanish. And we saw in the focus group discussions that after watching the PSA, participants were more willing to share their personal experiences of living with mental illness, their interactions with family members, and they asked a lot of detailed questions about how to get in touch with NAMI-NYC. We learned a lot, and we saw the real impact of the PSA video on how people felt about themselves and others living with mental health challenges. And we really encourage other nonprofits to give this a try. And Lorraine is going to share some recommendations.
Thank you, Yen. Yes, we have a couple of recommendations for organizations trying to replicate a PSA project like this one. The first and foremost, do your research. That's very, very important for any project, especially a project like this. In our case, we conducted on-street interviews and participants remain anonymous. That was one of the things that helped most for us to have that data and that result. We wanted real, authentic, honest answers. And our surveys and focus groups were also anonymous, as I mentioned before. We can't underestimate the value of talking to the community members directly. And I really recommend that. I know that digital platforms are available for us, but it's important to be face-to-face to the community to get more information about how they feel, and also the community feels heard. Another recommendation is be strategic. A PSA is not the same thing as the nonfiction stories we typically film. For this, we gathered our research and found strong family support themes. After that, we scripted the PSA and hired actors to deliver a quick, effective, and concise message. That was all part of the strategy that we developed. Another recommendation is representation matters. We knew it was important that our staff conducting interviews identified as part of the cultural community and spoke the language fluently. And also stay open to information, to any information that you can collect besides the one that you are planning to get. Also, our focus groups was the Hispanic community, the Hispanic Latino community. We kept our interviews open to all New Yorkers who wanted to chat with us. We made this original report detailing findings from Black, Brown, and AAPI communities. And these individuals share the difficulties of sharing about mental health in immigrant families. This PSA also now stands as a foundational resource for future programming and campaigns, which could be tailored to New Yorkers in monolingual Chinese or Arabic communities. This was a result to just stay open to the data that we could collect out there, just stay open. Besides the strategy that we had just to create more conversations about mental health and mental illness in New York.
Thanks so much, Jen and Lorena, for giving us so much information to help guide others and learn more about our project. I hope you can tell that NAMI New York City is a lifeline for those who are navigating the challenges for caring for a loved one living with mental illness. We encourage you strongly to please share this PSA, which is available at NAMI-NYC.org/PSA, to help us spread awareness and connect individuals with the resources they need. And if you're embarking on your own PSA project or you're seeking guidance, we welcome your questions and are eager to share some of the lessons that we've learned. Get in touch by visiting NAMI-NYC.org/helpline. Thank you.
Desde que nos mudamos a Nueva York, el comportamiento de mi hija cambió repentinamente. Sentí que se estaba alejando de mí y no sabía cómo ayudarla. Un día me di cuenta de que necesitábamos ayuda y decidí romper el silencio. Me di cuenta de que para ayudarla a ella tenía que comenzar por mí. Hablar con alguien acerca de cómo me siento no solo me ha ayudado a entenderla, sino que también salvó nuestra relación. Conversar abiertamente sobre la salud mental nos acerca y beneficia a todos. No estás sola. Más de un tercio de los padres o tutores latinos han padecido de depresión, ansiedad y otras condiciones de salud mental. Acérquese a NAMI de la ciudad de Nueva York. Estamos aquí para apoyarles sin ningún costo.